Aloha and great afternoon, everyone. Welcome to the Senate Committee on Public Safety and Military Affairs. Today is January 27, 2025, and we are in conference room 225. This hearing is also being streamed on the Hawaii State Senate's YouTube channel. A few housekeeping announcements. In the unlikely case of technical failures, this meeting will reconvene here in conference room 225 at 3:10 p.m. on January 29. For all testifiers, including those on Zoom, we ask that you stand on your written testimony. If your oral testimony is different from your written testimony, the time limit for each testifier will be 1 minute. The content, including the hearing notice, copies of the bills, and testimony can be found on the legislature's website. If time permits, decision-making will occur after we hear from those offering testimony. First on our agenda is Senate Bill 224 relating to identification, requires the Department of Corrections and Rehabilitation in collaboration with the various agencies and upon request of the inmates to assist inmates in obtaining the inmate's civil identification card, birth certificate, social security card, and other relevant identification necessary for successful re-entry into society as soon as practical. Requires the Department of Corrections and Rehabilitation to initiate the process of obtaining identifying documents for inmates released to work, furlough, extended furlough, or community placement programs by providing the forms necessary for the inmate to obtain civil identification cards and other identifying documents to the inmate as soon as possible. On our testifier list, Director Tommy Johnson from DCR. Okay, thank you so much, DCR in support. Kristen Johnson, Oversight Coordinator.
Aloha, my name is Kristen Johnson. I'm the Oversight Coordinator for the Hawaii Correctional System Oversight Commission. We stand in support of our testimony and just wanted to reiterate that we agree with the department that reentry should start on day one. Thank you.
Thank you. From the Director of Human Services, State of Hawaii, we have Director Ryan Yamane offering comments. Rebecca Like, Prosecuting Attorney in support, County of Kauai. Lois Etrischek, testifying for the Hawaii Disability Rights Center in support. Alexis Charpentier, CEO for Waikiki Health in support. Kat Brady.
Good afternoon, Senator and all senators. Kat Brady testifying in strong support of this measure for Community Alliance on Prisons. One of the things that I noticed in my research was that some jurisdictions actually help people get driver's licenses, and that might be a good thing. And this is something that I'm going to give to the department because it's a whole list of things from the Department of Transportation on how you can actually do this right.
Thank you.
Thanks.
We have Sydney Story testifying for Opportunity for Youth Action Hawaii in support. Michael Oder in support. Veronica Moore, Sylvia Madison, and Carolyn Eaton all in support. Is there anyone who wishes to testify on this issue? Yes, please come forward.
Angela Melody Young, Rory Cares, in strong support, and I submitted testimony online. I don't know if you got it though. Okay, so without identification, people cannot go to bars, rent an apartment, book a hotel room, or buy a car. Each year, more than 600,000 people are released from state and federal prisons, and many times these people re-entering society do not have the opportunity or means to obtain important identification documents. So individuals re-entering society often face burdensome barriers when obtaining housing and employment due to difficulties with identification. To address this issue, states have adopted a variety of laws to help prior offenders with identification issues when reintegrating with society. And this policy snapshot can provide states with a set of standards as a focus to helping inmates. For example, some states have chosen to work with the DMV. So people writing for these policies relating to this topic
Thank
with
you,
inmates.
Ms. Young. Thank you. That completes our list of registered testifiers. Is there anyone else in the audience that wishes to testify on SB 224? Members, questions? I have a question for Director Johnson. Thank you, Director, and thank you for your testimony and support. So on the Commission of Oversight's testimony, it did highlight that a report that 10,500 individuals were released in 2022 and only 150 received identification cards, and 32 were provided at no cost, and then it gives the spending at about 62,000. I know last time we've heard about an issue like this, a proposed legislation, the department was attempting to work with specifically the Customer Services Division at the City and County of Honolulu.
Yes.
How has that relationship been in terms of getting some of these ID cards or materials that you need?
We have the satellite ID card machine up and running at Halal. It's been running for a while. What the delay we experienced was that they were going to upgrade their machines and potentially change the vendor. So we had to wait until they made their decision before we purchased the new satellite ID card machines. Now that we have the specifications, we will purchase them for the 4 facilities in a certain order we've determined based on the population and our experience where the need is.
And you have funding in your budget to go ahead and procure and purchase
Yes,
that
we do.
equipment?
Yes.
Okay, thank you. Members, any other questions? Okay, that's good, okay. Or if not, thank you. We'll move on to our next bill, SB 474, relating to psychologists. This requires clinical psychologists employed by the Department of Corrections and Rehabilitation to obtain licensure within 10 years from the date of employment, sunsets on July 1st, 2035. First from the Department of DCR is Director Johnson.
Thank you, Chair Elefante, Vice Chair Wakai, and members of the committee. I'll just summarize my testimony since I have 1 minute. We support this measure. We strongly support this measure. A couple of challenges that the applicants face. In 2024, only 54.17% passed it looks like passed the testing. A national average is approximately 32%. So while Hawaii is doing better than most, we're still losing psychologists left and right. Right now, of 23 clinical psychologist positions, 20 of them are currently vacant. The 3 positions we filled are unlicensed, and 1 person is coming up on the 2-year limitation. We did submit corrected testimony. The last sentence of paragraph 2 on the second page read contract that should read statutory.
Yeah, and we have that.
Okay. And subject to your questions, that's all I have. We think this is needed.
Thank you, Director. Next up is Melissa Pavlicek, Committee Chair for testifying for the Hawai'i Psychological Association.
Aloha, Senators. We stand on our written testimony expressing concerns and just wanted to be available for questions.
Could you identify yourself, please?
Melissa Pavlicek on behalf of the Hawaii Psychological Association.
Okay, thank you.
Thanks.
And Veronica Moore in opposition. That completes our list of registered testifiers. Anyone else that wishes to testify on SB 474? Yes.
Angela Melody Young, Roy Cares, brief comment. So this is about the requirements for psychologists serving in civil service clinical positions to get a license during employment. So my comment is, shouldn't it be prior to employment? For example, many people in jails and prisons in the United States have mental health issues that are occurring prior to their offense. They offend because they have deep-rooted behavior mental health problems that create violent and disturbing behavior. So they have disproportionate effects in their health and wealth disparities. So they lack the access to have mental health care. And so let's say they have a history of mental illness, a diagnosis of mental illness, or a series of mental health symptoms. To provide the best care in correctional facilities, shouldn't the doctors be licensed before dealing with the most vulnerable population? Criminal justice systems has a disproportionate impact upon those who already have the health disparities. And to create the equity is to make sure that the doctors practicing in the correctional facilities are abiding by the highest standards of the law.
Thank you.
Thank you.
Is there anyone else that wishes to testify on SB 474? Okay, if not, members, questions? If I could bring back Ms. Pavlicek and Director Johnson, if you two don't mind coming up. Hi. Would you be open if we were to amend it rather than 10 years to a shorter time frame and add a sunset clause to the proposed measure? Would that be okay with you instead of 10 years?
So we looking at 9?
More like 5.
the Psychological Association really wanted to express the need to have strong and uniform standards regardless of the vulnerable population. But I think your idea to reduce the number of years and perhaps put a sunset is a good one.
Okay,
Fair enough.
okay, thank you.
Thank you.
Okay, members? Oh, yeah, Vice Chair Wakai.
I'm trying to understand the problem and this solution that we're chasing here. So if we were to not extend the opportunity to 10 years, then Director Johnson, you will have even fewer, you said what, 3 out of the 23 positions are filled.
Correct.
So if you don't get this kind of reprieve, then we could have 0 out of 23 there to service anybody in the criminal justice system.
That is a possibility. I think I would prefer the 10 years, but if the negotiation is at 5, then we'll have to try to get them licensed at 5. But we also we contract with private providers to kind of fill the pukas that we have.
Okay, so but Melissa, I understand your position, that you want to raise the bar and not diminish the value
Or
of.
at least maintain the bar. And I think really the work that the legislature is doing to address the affordability of homes, reducing the cost of living, ensuring a good, then we're attracting more of a healthcare workforce to Hawaii. So we really want to look at the working conditions for psychologists and for other healthcare workers. So reducing the amount of, lengthening the amount of time before you have to get licensed doesn't seem like the best safety measure. And I understand, and we definitely acknowledge the lack of psychologists available, but look to other solutions to address it.
Okay. Can you share with us just briefly, like, what are the other solutions? Because it seems like we're just fiddling around with the lack here, but we're not getting to the root cause, which is a lack of psychologists. I mean.
I think it's an overall lack of healthcare professionals in our state, not just psychologists, but it is a comprehensive issue of not having enough qualified workers for many reasons related to quality of life, quality of work in the workplace, and things like that. So just extending the time for psychologists to be able to get licensed, especially for a long period of time, like 10 years, doesn't seem like a good answer. It might do more harm than good.
Okay, thank you.
This may be a deferred question, but one thing the legislature may want to consider is some type of shortage differential or some type of pay incentive for those that work in correctional facilities, because as a psychologist, they would probably rather work in a clinical setting and not a jail or prison. The atmosphere and the physical layout and the stresses are completely different, particularly in the jail setting where there's movement day in and day out, 24/7.
Okay, yeah. Senator Ducart.
For Director, is your agency putting maybe increased salaries into your budget? Just being that you suggested to.
We can't just increase the salary because it's based on the salary schedule as set with civil service. What I did do, though, I recently submitted a request to DHER to put a shortage differential on every classification of work where we're 20% and higher vacancies to kind of address that.
Members, any other questions? Okay, if not, thank you.
Thank you.
Moving on to our next bill, which is SB 353, relating to emergency management, amends Chapter 127A HRS to clarify state and local authority, prohibits the governor or mayor from suspending requests for public records or vital specifics during a state of an emergency, adds definition of the term severe warning, allows the legislature and city councils to terminate a state of emergency in whole or in part, issued by the governor or mayor respectively. First we have is Carlota Amarino, Director of the Office of Information Practices, submitting comments. Director Yamane on Zoom, or maybe there's other testifiers from DHS. Hello.
Aloha, Chair, Vice Chair, members. I am Amanda Stevens, Public Information Officer for the Department of Human Services. DHS has provided comments and written testimony, and we're available for questions. Mahalo.
Okay, thank you so much. Administrator Barros from Hawai'i.
Hello, Chair, Vice Chair, members of the committee. Hawai'i stands on a written testimony opposing this bill.
Okay, and if you could just identify yourself, please.
James Browse from Hawai'i.
Thank you. Okay, we also have Ben Crepes for testifying for Public First Law Center in support. Douglas Meller, testifying for League of Women Voters of Hawaii in support. Ted Kafalis, Director of Strategic Campaigns, Grassroots Institute of Hawaii in support. And the following others in support: Jacob Weineck, Brett Kolbis, and Lynn Matisol in support. And that completes our list of registered testifiers for SB 353. Anyone else? Okay, if not, members, questions? One question for Administrator Barros. Thank you. I know this has come up before in the past, but could you share with the committee and the public what your specific opposition is to the proposed bill?
Towards the end of the bill where it says that the legislator or the city council can suspend an emergency proc. During an emergency, from my perspective, we want the executive to have the flexibility. During that emergency proclamation, it allows us to tap into the MDF, the Major Disaster Fund. And I'm afraid that if the legislators decide, okay, and override the governor on the emergency proclamation, then it closes some avenues for us for emergency management.
Okay, thank you. Members, other questions? Senator Rhodes?
Let me follow up on that. So if we knew that to be the case, why would the legislature cut off the emergency if we still needed it and there was some reason to keep going with it? I mean, it's just substituting it's one group of people making the decision instead of another. But why do you believe that the legislature would be a worse decision maker for that particular decision?
We're leaving it with the governor to make that decision.
So that's my question. Why?
He would have a overall holistic perspective of what we're trying to do in the response and recovery phase.
And we don't?
No, not saying that you don't, but he'll see the holistic approach of where we're trying to get through, from the emergency managers to the recovery aspect.
Okay. All right. Thanks.
Follow-up, Chair.
Yes, Senator DeCourt.
In your testimony, you had said, quoting, would limit executive powers, would be limitations to the use of any monies from the Major Disaster Fund. Is that speculative, or is that something you know to be true? Because it seemed just pretty subjective as far as it might limit funding. It may limit executive powers. So just wondering, it was a strong statement.
Yeah, it will. Without the emergency proc, we don't have access to the Major Disaster Fund. So it would close that off for us.
Thank you. Any other questions? Senator Fukunaga.
You know, it would seem that the language of the bill is kind of tailored, to avoid interfering with emergencies or disasters that are kind of obvious, wildfires, et cetera, et cetera. It seems that the language on the last page does not otherwise interfere with FEMA's and the executive branch's responsibilities. It's kind of more, I think, in terms of I guess the most recent experience was the ongoing set of COVID emergency proclamations. There are some, and I think for those who served on the city council, we had many complaints from individuals who felt as though they were being unfairly restricted or restrained, during that kind of time period. I guess it would seem to be that this language is more directed at instances where the need for immediate emergency services and management has sort of ended, and the conditions seem to be normal. And so I think that's kind of more what the language of the bill is intended to address.
Yeah, I noticed it starts off with our experience with COVID, and our ability from the emergency manager's perspective is to set the conditions so that we know when the emergency is over, and briefing the governor and the executives on that, saying, at this point, we're no longer in that emergency phase. So I think we can do a better job from the emergency managers to set that expectations for the governor and the executives and for the legislators.
Perhaps further crafting of language together with your department.
Yes.
Okay, thank you.
Okay, any other questions? If not, thank you, Administrator Barros. Okay, if there's no other testifiers, we'll move on to our next item, which is Senate Bill 259. This is relating to record keeping, establishes record keeping requirements for secondhand dealers requiring records to be retained for 2 years from the data cell, amends and standardized record keeping requirements for pawnbrokers requiring records to be retained for 2 years from the date of maturity. The only testifier we have is Councilmember Addison Bulasan in support. Anyone else wishes to testify on SB 259? There's no one to ask questions of. We'll move on to our last item, which is SB 307, relating to recordings of law enforcement activities, establishes the right of a person to record law enforcement activities, establishes a private right of action for any violation of the right to record law enforcement activities. First with us is Nathan Lee from ACLU on Zoom.
Not present on Zoom, Chair.
Okay, thank you, Natasha Sandima.
Good afternoon, Chair, Vice Chair, and members of the committee. Sandy Ma for the Legal Clinic. We are testifying in support of this bill. We just have a clarifying question. We wanted to make sure that this bill covers civil enforcement actions. Thank you.
Okay, thank you. Douglas Meller in support. Nancy Cook-Lar in support. Tiffany Edwards Hunt in support. Lynn Modisal and Michael Order in support. And then Damon Tucker with comments on Zoom.
Not present on Zoom, Chair.
Okay, is there anyone else, IT, on Zoom for this?
No other participants on Zoom, Chair.
Okay, anyone else in the audience that wishes to testify on SB 307? Okay, if not, members, questions? Okay, if not, I'm prepared to roll into decision-making if everyone's okay with that. Okay. Thank you, members. For the first one, SB 224 relating to identification, recommendation is to pass as is. Any further discussion? Okay, if not, Vice Chair Wakai.
Chair Elefante,
Aye.
Vice Chair votes yes. Senator Fukunaga.
Aye.
Senator Rhodes.
Aye.
Senator Ducourt.
Aye.
Chair, your recommendation is adopted.
Okay, thank you so much. Next item on agenda is SB 474 relating to psychologists. Recommendation here is to pass with amendments. The amendments will be as follows. On page 1, line 10 of the bill, change 10 years to 5 years. On page 2, line 2, change the sunset date of July 1st, 2035 to July 1st, 2030. And then we're going to change the effective date to July 1st, 2077, and any other technical amendments. Okay, any other discussion? Okay, if not, Vice Chair for the vote.
Noting the presence of all members, any opposition or reservations to the chair's recommendation, we pass this measure with amendments. Having seen and heard none, Chair, your recommendation is adopted.
Okay, thank you so much. Next one is SB 353 relating to emergency management. Recommendation here is to pass with amendments. On page 14, line 16, change the effective date from upon approval to July 1st, 2077. And any other technical amendments. Also in the committee report, we're going to include information that contained in the Department of Human Services testimony, which is on page 3, paragraph 3. This specifically has to deal with, let me pull it up here, the amount of requests that DHS has gotten in. So we'll start off with that third paragraph where the line starts, DHS continues to experience an increase in UPA requests since the COVID-19 pandemic and Maui wildfires, and it goes on to read there was an 89% increase in UIPA requests from 2019 to 2020. There's a 77% increase in UIA-PIA requests between 2020 to 2021. There was an increase of 43% in UIPA requests from 2021 to 2022, and there was an increase of 30% in UIA-PIA requests from 2022 to 2023. And then additionally, I'd like to add into the committee report noting the specific opposition for the parts from Ha'ima, which would be on section E and F, right, Administrator? So on the bill, this would be on page, we'll just note this in the committee report, Hawai'i's opposition on page 14, subsection E, which begins at line 7, and subsection F, which begins on line 11. Okay, with that, that's my recommendation with those amendments. Any further discussion? Okay, if not, Vice Chair for the vote.
Noting the presence of all members, any opposition or reservations to the chair's recommendation, we pass this measure with amendments. Seeing heard none, Chair, your recommendation is adopted.
Thank you so much. SB 259 relating to record keeping. Chair would like to pass with amendments, but defer decision-making. Can I defer to Wednesday? Can I add it onto the Wednesday agenda? Yeah. Just because we haven't heard, this was a Honolulu Police Department package bill, and there was no testimony from HPD, so I'd like to reach out to HPD to get their input on feedback. So with that being said, I'd like to amend, and then we'll postpone decision-making till Wednesday in this room, 225, January 27, 2025 at 3:10 p.m. So the recommendation is we're going to amend, 29th, January 29th, 2025. We're going to amend and then postpone decision-making. And what I'd like to do is on page 4, line 6, change the effective date to July 1st, 2077 and any technical amendments. And then we'll take decision-making then. So any further discussion on the proposed amendments, and then we'll do the DM on Wednesday. Okay, if not, we have to take a vote. No, okay. And then finally, SB 307, which is relating to recordings of law enforcement activities. Recommendation here is to pass with amendments on page 5, line 8, change the effective date to July 1st, 2077, and any technical amendments. Any further discussion? Okay, if not, Vice Chair for the vote.
Noting the presence of all members, any opposition or reservations to the chair's recommendation, we pass this measure with amendments. And seeing heard none, Chair, your recommendation is adopted.
Okay, that concludes our 3 p.m. agenda today. We're adjourned.